Unions are calling on the government to postpone a deadline for NHS staff to be vaccinated against COVID, warning of a catastrophic impact on services already struggling to find enough workers. From April, all frontline staff in the NHS and the independent sector must have been jabbed. The government says the measure will keep patients and staff safe, but some feel so strongly they're willing to leave their jobs.
In her 21 years as a midwife working independently and for the NHS, Erika Thompson has helped hundreds of women like Shannon through pregnancy and birth. Now Erika faces that career ending because she's chosen not to be vaccinated against COVID. By April, it will be mandatory for all patient-facing staff.
I don't want to not be a midwife anymore. I feel like it's part of who I am, but I also really feel strongly that a mandate is not the way forward, and that it's infringing on our human rights to make these decisions.
Erika says she's not against vaccines, but made a personal decision not to be vaccinated after suffering from heart inflammation conditions.
From the evidence that I've seen, there can be, very rarely, and I want to stress that, very rarely, there can be links to those conditions with the vaccine. And so for me, I felt that was too big a risk.
But wouldn't there also be risks from not having the vaccine and being seriously ill, dying from COVID?
Absolutely, yeah. And so I looked at my age group, my health, my individual circumstances. I have had COVID and I have got natural immunity, and I think we need to ask the question, why are we not considering natural immunity in this equation?
The government says vaccinations save lives and cut infection levels, and mandating vaccines is an important step.
It's critical to patient safety that health and care staff get the jab, to protect some of the most vulnerable people who are in their care, and also keep the NHS workforce strong in the wake of Omicron.
The Health Secretary was challenged over the mandate last week by Dr. Steve James, a critical care consultant at King's College Hospital who's had COVID.
The protection I've got from transmission is probably equivalent to someone who's vaccinated.
Yeah.